speak about where we see the ILAE in helping development of epilepsy services and eradicating stigma in Africa. As has been introduced, I'm Professor of Childhood Epilepsy at UCL and Great Ormond Street Hospital in London, UK. But I've been on the management committee and elected to the management committee of the ILAE over the last 8 years, most recently as treasurer, and due to take up the presidency at the beginning of September. So what is the International League Against Epilepsy? Well, it's the global organisation for all professionals involved in the care and management and care of people with epilepsy. It's a worldwide organisation. We have 123 country chapters. They're divided then into 6 regional boards, but we have a variety of topic commissions in order to develop different topics on an international level, and 4 councils, which have recently become established because of ongoing things that need to be delivered across our 4-year terms. Africa has 17 chapter members, although 1 is further to be ratified in September to bring it to 18. And each region, of course, is overseen by a regional board, an elected regional board. And this is the current regional board for 2017 to 21, a new regional board to be taken up to start in September. The current chair being Angelina Kakuza from Uganda, and the next chair will be Joe Wilmshurst from South Africa. So if we look at the overall mission of the International League Against Epilepsy, is to ensure the health professionals, patients, their carers, governments and the public worldwide have the educational and research tools that are essential in understanding, diagnosing and treating persons with epilepsy. And we have a specific goals, all of which are really relevant to every country in the world. Not least to serve health professionals as the premier resource for current and emerging standards and best practice, supporting health professionals to enhance their knowledge and skills in prevention, diagnosis and treatment of care of epilepsy, advocate for epilepsy as a public health imperative, and promote research and innovation in epilepsy. And more recently, we have renewed our strategy for 2022 to 2030. Now our strategy divided into 5 goals, which covers many areas of relevance, again, to all countries in the world, not least looking at standards and best practice, education and advocacy, but also with cross-cutting themes, not least events and congresses, publications and communications, all of which are really relevant for dissemination of information and ensuring best practice around the world. So what about the specific role of the International League in developing services? Well, of course, we're not in the League of going to a country level and really developing services at that level. What we can do is provide different aspects to actually aid in that from a global level. So I've divided it into 4, not least that we can determine the evidence base there is for looking as to whether there is a problem perhaps in service delivery or even management of epilepsy or other aspects around the world, and what may make a difference. We can look at education, this being a key priority of the International League, not least particularly with regard to virtual learning to ensure a wider reach, as well as workshops, webinars, congresses, all of which, of course, have been in a very changing world over the past 12 months with COVID and us moving to more online, but we need to keep constantly change and look at that in the future. Advocacy, working in partnership with patients, patient organisations and other organisations, and perhaps lobbying and discussion with governments alongside the WHO. And of course, a prime example of that is the IGAP development that I will talk briefly about, and I think Sam Weeb will talk about later. And what tools can we advocate for, not least in what research may enhance the developing of services, and what tools do we need to look at and encourage, particularly with regard to validation. So just to give some examples, what about evidence? And I actually raised this example with regard to stigma, as this was specifically in the title of my talk. And in the term 2013 to 2017, we did have a task force that were set to address the issue of stigma and attitudes towards epilepsy, while still realizing that it was very much a problem, and to look and see what evidence there was in the literature to what degree the problem was, how we could look at that problem, and how that we may be able to address it, in addition to what tools there may be to both measure and address stigma and attitudes. And this particular paper, which addressed an enormous number of abstracts, which is particularly about stigma, both felt and enacted, is about to be submitted for publication, but raised a number of issues, not least that reported rates of both felt and enacted stigma varied both across countries and geographical regions, and even within them. And that negative attitudes represented a significant social comorbidity for persons living with epilepsy. Not to go through everything, the key issues were that evidence supported a need to focus on education to decrease enacted stigma and negative attitudes against people with epilepsy, and also the recognition that the direct impact of uncontrolled epilepsy on felt stigma had to be acknowledged, highlighting an urgent need to decrease the treatment gap, particularly in underserved regions. So what about education? Well, knowing that we cannot go physically to many places and wanting to have a global reach, we launched the International League Against Epilepsy Academy last year with regard to virtual learning, but also having developed a competency-based educational curriculum. Level 1 at an entry level and a primary has actually been established. A primary care curriculum is also being established, and work is being made on the next level up, which would be level 2. But also there are online tools available through the Academy, case-based tools in order to achieve different levels of the curricula. And yes, there is a charge. It's not all free, but that said, there is a differential for charge across the World Bank rankings, so to make sure that we can enable it to be available to as many as possible. But there are also other courses that we've been involved in. The British Paediatric Neurology Association developed standardized courses for paediatric epilepsy training, initially in the UK and then branched out to an international level, and have now joined forces with the International League Against Epilepsy, particularly in delivery across the world. And there are 3 levels of course. Level 1, which is a 1-day course for all those who may come into contact with children with epilepsy. There's then level 2, which is over 2 lots of 2 days, and a more advanced expert, which is more advanced. But the 1-day course has been adapted for relevance to Africa and the certain settings where delivery of services will be. And these courses were delivered face-to-face across a range of countries between 2016 and 19. In 2019, it was translated to Portuguese and delivered in Angola by the Brazilians. And over the past year, we've had to revert to a virtual format, of course, which has been highly successful. And it's been delivered in Ghana, Kenya, and there's also been a Pan-African course, and about to be a course delivered in Portuguese in Mozambique. We are also proceeding with translation to French and hope to launch a PET course in one of the French-speaking countries in Africa very shortly. Over the last 5 years, the course has been estimated to reach over 1,000 healthcare workers in Africa, ranging from practitioners who are either institutional leaders right down to those at the rock face, so a wide range of individual, and creating a common language and approach to children with seizures. Of course, congresses, webinars continue. The Eastern Mediterranean region and Africa run joint webinars, also in French and English. And we do have to think in due course where we are with congresses. It's unlikely we're going to be able to deliver face-to-face congresses for at least another 12 months. And therefore, thinking hard about how we may deliver things, maybe more regionally on a virtual basis. What about advocacy? Well, as an example, I'm just going to summarize a long history we've had with working with IBOBE jointly, and which is the International Bureau for Epilepsy, the patient organization, and the WHO. Starting in 1997 with the Out of the Shadows Global Campaign Against Epilepsy, trying to improve services, but utilising, in the first instance, demonstration projects to demonstrate the problem and try and enhance services within countries. With a lot of work over time, in 2015, we had the WHO resolution looking at the need for coordinated action at the country level to address the problems. In 2019, the global report on epilepsy, highlighting all the concerns that are global and not necessarily isolated to certain parts of the world. And then, of course, in November of last year, the WHO resolution to create and implement an intersectoral global action plan on epilepsy and other neurological disorders. This, after a sustained effort in collaboration with not only the IB but also the World Federation for Neurology and the European Federation for Neurological Alliance, and the WHO, of course, very much in conjunction. And this, of course, is now the first draft has just been released for comment, and I know that Sam Weeb will discuss this later. But then it's all very well from having a top-down approach as to what needs to happen, but what can we do at helping at a more ground level to enhance the educational side? Well, it's not just a case about giving out machines to do EEGs, and in fact, that's something we don't want to do on a regular basis, not least because it needs training, it needs regular sustainability for upkeep of machines, and also, of course, interpretation of the EEG. And therefore, this is much better to be directed at a local level. This said, it doesn't mean to say we don't want to advocate for increasing tools to aid in diagnosis and management, not least perhaps utilising smartphones, videos, uploading videos for diagnosis, utilising apps. But also, of course, key and something that's really become apparent over the past 12 months has been the issue of connectivity, not least for telehealth. And maybe, one thing that we've discovered through a survey we performed over the part of period last year was, although telemedicine really took off in the COVID era, there was a real issue about ongoing connectivity and the World Wide Web. And that's something perhaps we should take forward and try and advocate for. There are we continue with task forces and groups. The Task Force for Access to Treatment is currently looking at a survey to see where the problems lie, what problems lie in access to medicines. We work in conjunction with other organisations to implement guidelines, but also anything that we generate needs to be applicable to any resource setting, whether it be directed at resource limited regions or indeed making sure, for example, our classification of seizure types is applicable to any diagnostic setting. And now we've also, along with the Global Advocacy Council that we have, looking at how we can move forward. Yes, we've been involved in moving forward with IGAP, but this is an example of us trying to find out what's going on around the world, and particularly in different countries with regard to projects that may give information with regard to delivery of services. And this is a database that's now held within the International League Against Epilepsy database. So trying to enhance connectivity, dissemination, but also perhaps collaboration. So moving forward, there's no doubt that education will continue to be key. We need to have further development of the curriculum to different levels, make sure we develop continued online materials, and make sure that we continue to communicate through webinars and other online fora. But also delivery of courses, how are we going to move forward with congress and courses, and these may need to be adapted to any country and regional situation. We want to continue to work towards advocating the development of the Intersectoral Global Action Plan. That's due to be completed in the autumn of this year and submitted to the World Health Assembly in 2022. We will work through the regional board to determine further sub-regional and chapter requirements. What ideas are there as to how we can support further? Although raising awareness and education continue to be key. And we will, of course, continue to work with other organisations to increase the strength of what we do, but also not duplicate efforts. Thanks very much.
Okay, thank you very much. Thank you very much, Dr. Cross. And I'm taking over from Emma. Just want to open the floor for any questions for Dr. Helen Cross.
Yeah, thank you very much, Anna. Thank you, Professor Helen Cross. Nice to hear from you and to meet you during this webinar. We hope to meet together as we did in Marrakesh in the meeting, and also in Uganda. So my question, as you know, I'm involved in telemedicine in IBE with the Professor Martin Brodin. We had good collaboration in Entebbe when we discussed with some people and other partners. So I think, as you mentioned, the key solution for developing countries like Africa, Latin America, and Asia is telemedicine. So I think, how could we collaborate and how could we make good plan for educating not only specialists or general practitioners, but I think we have also to think about nurses, especially in Africa when sometimes specialists are lacking, and we have to count on nurses to treat, to diagnose, and to manage epilepsy.
Well, I think this is where it is a multifaceted issue, because yes, telemedicine is good, is the way forward, but it's what we implement and how we implement it. So the first issue is what tools may be used for that telemedicine, and it could be anything. I mean, ranging from a Zoom call like we have now to WhatsApp to just telephone calls, and it's that the individual maybe needs some indication as to what needs to be asked and what preparation may be needed with regard to any consultation via telemedicine. And we've provided tools with regard to that through the COVID task force. And they are, we have some guidance on the International League website, and that could be utilized at a more local level with what other, considering the circumstance, in order to train, help with individuals. There is also the utilization of training about trying to diagnose epilepsy. How do we train individuals to recognize what are seizures, what questions to ask, even the utilization of video. And, something that we've been trying to work towards is maybe a video upload system, whether you have central recognition, how can that implement? And we've, that's working its way into perhaps some of the projects that are ongoing in Africa to try and assess the role of that in a primary care consultation. So it's not just a simple one answer, I don't think. I think there are many different aspects we need to look at. And I think we need to continue to have joint working to know the different levels this needs to be looked at, and indeed for the different groups of individuals for which it may be relevant.
Yeah, thank you. I have one suggestion. I will have one meeting next Monday with Professor Victor Peterson. As you know him, he's an expert in telemedicine from UK, and he has been with us in the Telemedicine Commission in IBE, and we published a few papers together. So we'll be discussing about the translation of the application of diagnosis of epilepsy, the one used in English and has been translated in Nepal language. We can maybe work together, of course, with you in ILE, in order to translate it in Arabic and French. And I think it's a very easy tool to assist patients sometimes to go to some probability of diagnosis before asking them to go to the physicians.
Absolutely. I know very much well of Victor's app. It's very good. It's particularly for convulsive seizures. And I know others who are working on an app with regard to non-convulsive seizures within the EPILE project in Kenya. So I think all these tools are things that we can move forward with.
Thank you very much, and good luck.
Thank you very much, Dr. Najib.
I have a question. Hello?
Yeah, yes, Chantal, go ahead.
Yeah, I would like to thank Dr. Najib about his telehealth, because last time he saved the life of an infant in Rwanda suffering for autism and seizures. So regards our continent, I think many doctors are not experiment well to analyze the brain and to know exactly which drug to give to those children. So many times they are suffering for SPAS syndrome until adulthood, and they become handicapped for life. And I would like to ask if ELA, as a president of Africa, the regional president of Africa, include Dr. Helen and Dr. Najib, if they can organize a boot camp for pediatric training. So we can give it to our doctors who are looking after those children, because they are not well experienced. Like in Rwanda now, we have a 5 pediatric doctor, but they are not expert on neurology. So we need to give them a better training to know exactly the assessment of that brain and how they can combine different drugs to stabilize those kids. Like last time you see Dr. Chengo is part of the ELA, including Dr. Najib. They eliminate some drugs and those kids now they're alive. And the parent thanks me. It's not for me, it's for the ELA. And I think we need to have...
Yeah, I think absolutely. And then this is where we have the pediatric epilepsy training courses, which we've been delivering in different countries, and we're happy to expand that. And, you know, certainly with the virtual format, it is easier, but also we still need to have individuals trained to actually deliver that. But we can do that remotely. So it's something we very much recognize. And as I said, you know, we've had quite a reach already, but that doesn't mean to say we need further reach. And we're also translating it into French so that we'll be able to deliver it to the French-speaking countries. We wanted to launch that this year, but unfortunately, it usually needs to be a face-to-face launch, not be prior to virtual. And of course, that's been postponed, but we may be able to launch it virtually towards the end of the year. So, you know, I'm more than happy to be contacted. I did mean to put my email at the end. But you know, we very much have these pediatric epilepsy courses that we can deliver. And because they're virtual, it doesn't matter, you know, it can be delivered to many countries at the same time. We had one Pan-African course delivered very recently. So there were the model being that you deliver it remotely, but then you may have small workshops in your own country of individuals altogether. So, you know, there is a tool, the pediatric epilepsy training courses, and we're more than happy to hear if it would be valuable for you to participate. Or who would need to participate, not necessarily you.
Not me.
Okay.
It's
All
for
right,
doctors.
Thank you.
But you know who needs, you know, we can advertise it and get the appropriate people on board.
Thank you so much.
Yeah,
Thank
I
you,
think,
Dr.
Okay, can I?
If I can add one thing, I think
am
also we
gonna
can
have
now.
to stop.
I have
Just
one
one
question.
point. I think one point. I think we can also start some hybrid conferences.
Being a moderator is the worst job ever because you're cutting off people, but we're running out of time. So, Dr. Prince, make it quick, please.
Thank you very much, Prof. Najib. For the app application, the management of epilepsy app, we are already working with the Prof. Victor Patterson in the translation of English version. I have already done it with him. I think it will be available this week, before the end of this week. If not this evening, it will be tomorrow morning. We'll get the English French version. But my question to Dr. Helen, I want to know, because we know, and the app we have the challenge of internet, because this app, it will be very used in rural areas. There we have a very big challenge with the internet. And I want to know if you have a training plan for primary doctors and the nurses in rural areas in Africa where the internet is a big challenge, that the training face-to-face. I know that you are organizing training by teletraining, but what about the face-to-face training for primary doctors and nurses in rural areas, knowing that 17% are facing contact with the patient, donc the primary doctors, but we need to improve the knowledge of this category of healthcare of this person in the order to improve the management of epilepsy and the reliable epidemiological data in epilepsy. I want to know if you have this plan for in the rural areas for primary doctors and the nurses. Thank you.
Okay, so I think what you're asking is, you know, the fact that connectivity for the internet is poor in rural areas, and therefore what we can do from a face-to-face point of view. Is that correct?
Yes.
Yes,
yeah. Right.
And I think that's very, very important. I think we've delivered, we're developing the primary care curriculum, and materials. But then, we need to see, review what is possible. And, number one, we can tackle it from improving connectivity. And there really are moves from other organizations as well to try and advocate for improved connectivity. But then also perhaps provide tools that can be delivered face to face and utilize individuals within those areas that have got links to that in order to do that, much along the line of pediatric epilepsy training, but not just for children, for from a primary care level. So I fully acknowledge that, and I think that's something where we can provide educational material, but then look at how that can be delivered if it's taken on board at a more local level.
Thank you.
Okay, thank you very much, Dr. Cross. It was a pleasure to have you with us.